Imagine waking up to a world turned upside down. A world where the streets are eerily quiet, businesses are shuttered, and hospitals are overwhelmed. This was the reality for billions of people during the COVID-19 pandemic. But COVID-19 is just one example of how a virus can spread like wildfire across the globe, bringing with it death, economic turmoil, and social disruption. As we start this exploration, picture a montage of news clips, crowded hospitals, frantic healthcare workers, and empty cityscapes. These images are not just remnants of the past, but a reminder of the fragility of our world in the face of pandemics. COVID-19, like other recent outbreaks, Ebola, Zika, SARS, highlighted our vulnerability to emerging infectious diseases. These pathogens do not discriminate. They cross borders effortlessly, hitching rides on planes, ships, and human hosts. With every new outbreak, the question looms: are we prepared for the next one? Despite advancements in medicine and technology, the answer is often a resounding no. The global response to COVID-19 was marred by delays, misinformation, and logistical challenges, exposing deep flaws in our preparedness. Experts in global health have been sounding the alarm for years. The rapid pace of urbanization, deforestation, and global travel has created the perfect conditions for new diseases to emerge. These factors, combined with climate change, mean that the next pandemic could be just around the corner. To truly understand the threat, we must look at pandemics as not just health crises, but as complex events that disrupt every aspect of life, from the economy to mental health to international relations. Understanding pandemics is crucial not just for health professionals, but for everyone. The more informed we are, the better prepared we can be to protect ourselves and our communities. And as we'll see, preparation doesn't just mean having the right medical supplies. It means creating systems that can respond quickly, efficiently, and equitably. Chapter 2: The Silent Killer, Antibiotic Resistance. While pandemics often steal the spotlight, another equally dangerous threat is growing in the shadows: antibiotic resistance. Antibiotics, once hailed as miracle drugs, are becoming less effective as bacteria evolve to resist them. This phenomenon, known as antibiotic resistance, is turning once treatable infections into deadly threats. Picture this: a hospital room where a patient lies fighting an infection that doesn't respond to treatment. The doctors have tried multiple antibiotics, but none seem to work. This scenario, once rare, is becoming alarmingly common. Antibiotic-resistant bacteria, often referred to as superbugs, are on the rise, and they pose a serious threat to public health. The roots of this crisis are complex. Over the years, antibiotics have been overprescribed and often misused by doctors, patients, and even in agriculture. This overuse has accelerated the natural process of bacterial evolution, allowing resistant strains to thrive. Now, infections that were once easily cured, such as pneumonia, urinary tract infections, and tuberculosis, are becoming harder and sometimes impossible to treat. In the labs and hospitals where scientists and doctors battle these superbugs, the mood is one of urgency. "We are running out of options," says one infectious disease specialist. The pipeline for new antibiotics is running dry, and the development of new drugs is not keeping pace with the growing resistance. Without effective antibiotics, procedures we take for granted, like surgeries, chemotherapy, and even childbirth, could become incredibly risky. This is a silent crisis, one that doesn't make headlines as often as it should, but the implications are profound. Antibiotic resistance could lead to a future where minor infections are once again deadly, where medical advances are rolled back, and where the global health landscape is changed forever. Addressing this crisis requires a multifaceted approach: developing new antibiotics, improving stewardship of existing ones, and educating the public about the responsible use of these life-saving drugs. Chapter 3: The Healthcare Divide. As we shift our focus from the developed world to low-income countries, the disparities in healthcare access become glaringly apparent. In these regions, the struggle for basic healthcare is a daily reality. For millions of people, access to a doctor, life-saving medications, or even clean water is not guaranteed. Visualize a remote village where a line of people stretches far from a small, understaffed clinic. The wait can last for hours, or even days. For many, this wait is not just inconvenient, it can be deadly. These images are not just isolated snapshots. They represent a systemic issue that affects billions of people worldwide. Healthcare access is profoundly unequal. In high-income countries, people benefit from advanced medical technology, readily available vaccines, and comprehensive healthcare systems. But in many parts of the world, healthcare infrastructure is weak, underfunded, and often inaccessible. The statistics tell a grim story. Children born in low-income countries are far more likely to die before reaching the age of 5 than those born in wealthier nations. Women in these regions face higher risks during childbirth, and treatable diseases like malaria, HIV/AIDS, and tuberculosis continue to claim millions of lives. Through interviews with community health workers and patients, we hear the human stories behind the statistics. We do the best we can with what we have, says a nurse working in a rural clinic. But the resources are often insufficient. Patients sometimes walk for miles to receive care, only to be turned away because the clinic has run out of supplies. The human cost of this healthcare divide is immense, leading to unnecessary suffering and death. Chapter 4. Global Cooperation. In an increasingly interconnected world, global cooperation is more important than ever when it comes to tackling health issues that transcend national borders. Diseases do not respect boundaries, and neither should our efforts to combat them. But achieving meaningful cooperation on a global scale is easier said than done. Imagine footage from international health summits, where representatives from different nations gather to discuss strategies for combating global health threats. These meetings are a crucial part of the puzzle, bringing together experts, policymakers, and leaders from around the world. But the road to effective global cooperation is fraught with challenges. One of the primary hurdles is the diversity of priorities among countries. What may be a top priority for a high-income country, such as developing a new vaccine, might not align with the immediate needs of a low-income country struggling with basic healthcare access. Additionally, political tensions and economic disparities can make collaboration difficult. For example, during the COVID-19 pandemic, we witnessed how vaccine nationalism, where countries prioritized their own access to vaccines over sharing with others, hampered global efforts to control the virus. Experts stress the importance of strengthening international collaboration and information sharing. Global health organizations like the World Health Organization, WHO, play a pivotal role in coordinating these efforts. The WHO provides guidelines, facilitates the sharing of knowledge, and helps mobilize resources in response to health crises. However, the effectiveness of these efforts often depends on the willingness of individual countries to cooperate and contribute. The COVID-19 pandemic has taught us that no country can go it alone. A virus that emerges in one part of the world can quickly spread to another, making global cooperation essential for early detection, rapid response, and effective management of health threats. The same is true for other global health issues, such as antibiotic resistance and the spread of non-communicable diseases like diabetes and heart disease. For global cooperation to succeed, we must foster a spirit of solidarity, where nations recognize that their own health and well-being are intertwined with that of others. This requires not only political will, but also sustained investment in global health initiatives, transparent communication, and the sharing of resources and technologies. Chapter 5. Innovation and Investment. As we move into laboratories and research facilities, the role of innovation and investment in global health becomes apparent. These labs are where scientists and researchers work tirelessly to develop new vaccines, treatments, and diagnostic tools that can save lives. However, the road from research to real-world application is long, complex, and expensive. Innovation in healthcare is driven by the need to address emerging health threats, improve existing treatments, and make healthcare more accessible and affordable. But innovation doesn't happen in a vacuum. It requires significant investment. Developing a new drug, for example, can take years of research, testing, and regulatory approval, all of which require substantial financial resources. The importance of investment in research and development cannot be overstated. Without it, the pipeline for new medical technologies would dry up, leaving us vulnerable to new diseases and unable to combat existing ones effectively. However, funding for global health innovation is often insufficient, particularly in areas that do not promise immediate financial returns. Diseases that primarily affect low-income countries, such as malaria and tuberculosis, often receive less attention and funding than conditions prevalent in wealthier nations. Philanthropic organizations, governments, and private companies all play crucial roles in funding global health research. For example, initiatives like the Bill and Melinda Gates Foundation have invested billions in global health projects, leading to breakthroughs in vaccine development and disease prevention. Similarly, government-funded research agencies, such as the National Institutes of Health, NIH, in the United States, support a wide range of health-related research. But innovation is not just about developing new drugs and vaccines. It's also about finding ways to make existing treatments more accessible. This includes creating affordable diagnostic tools, improving the efficiency of healthcare delivery systems, and developing technologies that can be used in resource-limited settings. For example, mobile health technologies, mHealth, have the potential to revolutionize healthcare in remote and underserved areas by providing access to medical information, monitoring tools, and telemedicine services. Investment in global health innovation must also focus on sustainability. It's not enough to develop new technologies. We must ensure they are distributed equitably and used responsibly. This means building partnerships between governments, private companies, and non-governmental organizations, NGOs, to ensure that innovations reach those who need them most. Chapter 6. Addressing Social Determinants. As we shift focus to the broader context in which health disparities exist, we must examine the social determinants of health, factors like poverty, education, and the environment that profoundly shape health outcomes. These determinants are the conditions in which people are born, grow, live, work, and age, and they have a significant impact on an individual's health. Imagine scenes of crowded urban slums, rural areas with little access to clean water, and children attending underfunded schools. These images highlight the reality that health is not just about access to medical care. It's about the environment in which people live and the opportunities they have. Social determinants of health create a vicious cycle. For instance, poverty often leads to poor nutrition, inadequate housing, and limited access to health care, all of which contribute to higher rates of illness and lower life expectancy. Lack of education can limit employment opportunities, leading to economic hardship and further entrenching health disparities. Environmental factors, such as pollution and exposure to toxins, can also have devastating effects on health, particularly in marginalized communities. Experts emphasize that addressing these root causes is essential for achieving sustainable improvements in global health. We cannot simply treat the symptoms. We must address the underlying social and economic conditions that lead to poor health outcomes, says one public health advocate. This means taking a holistic approach to health that considers the social and environmental context in which people live. Efforts to address social determinants of health include initiatives to reduce poverty, improve education, and protect the environment. For example, programs that provide clean water and sanitation in developing countries can significantly reduce the incidence of waterborne diseases. Similarly, efforts to improve access to quality education can lead to better health outcomes by empowering individuals with the knowledge and skills they need to make informed decisions about their health. Public policies also play a crucial role in addressing social determinants of health. Governments can implement policies that promote economic equality, protect workers' rights, and ensure access to affordable housing and health care. At the same time, international organizations and NGOs can support community-based initiatives that address specific health challenges in different regions. Chapter 7. Building Resilient Health Systems. As we showcase examples of countries with strong healthcare infrastructure, the importance of investing in primary care, public health, and emergency preparedness becomes clear. In these countries, healthcare systems are equipped to respond to health emergencies, provide preventive care, and ensure that everyone has access to essential services. Universal health coverage is a key goal for many nations. It means that all individuals have access to the health services they need without facing financial hardship. Strong primary care systems are the foundation of universal health coverage, providing a first point of contact for patients and addressing a wide range of health needs. Public health infrastructure, including surveillance systems, laboratories, and emergency response teams, is essential for detecting and responding to health threats. We must invest in health systems that can withstand shocks, says a health policy expert. This is not just about building hospitals. It's about creating systems that can adapt and respond to new challenges. As we conclude, we are reminded that global health is not just the responsibility of governments and organizations. It is the responsibility of each of us. The camera pans over a powerful montage of individuals taking action to improve global health. A doctor volunteering in a remote clinic, a scientist developing a new vaccine, a community leader organizing a health education campaign. We all have a role to play in creating a healthier world. Whether through advocacy, donations, volunteering, or simply making informed choices, we can contribute to the fight against global health challenges. The future of global health is in our hands, says a health advocate. Together we can make a difference. In the final moments, we are left with a message of hope and determination. The challenges we face are significant, but they are not insurmountable. With collective action, innovation, and a commitment to equity, we can build a healthier world for all.